Karibu sana, Your Excellency.
His Excellency.
Having seen the success of this program in this county, that it is necessary to support the Operation Eyesight unit, actually launch this program across the country for the benefit of all the citizens of this county. So I want to urge Minister of Education to support the Operation Eyesight unit so that this program can be upscaled and all our children in all our schools in the country can benefit. This program should be launched in Noreb very fast. And I now speak as the chairman of the North Rift Economic Bloc, that all the children in North Rift should be screened. And we are willing as governors of this county to sit, discuss, partner, and see how we can make this possible. If we screen in Uasin Gishu 100% successfully, I can tell you it becomes easy for this program to be uptaken in most of the counties. We are a county of collaboration. There is no partner who comes here and works with us well and their programs fail to succeed. That I can tell you. We have a very robust public service in this county. We are more than willing as county government to take part of the responsibility so that all the children in our schools can be screened.
We've had tremendous growth in the number of clients seeking eye care services. And for the last 6 years, we have seen approximately 110,000 who have been screened for eye services, and 70,000 have received various forms of interventions ranging from surgeries to optical services.
At Operation Eyesight, we believe that every child has the right to sight. Every child has the right to an education and to a healthy, fulfilling life. Through this program, we are training teachers to screen students or learners now, learners for vision problems, so we can ensure that the learners get the help they need to see clearly. Children who need prescription eyeglasses receive a free pair of glasses. Children who need further care are referred to one of our partner facilities, which is the MTRH, where they receive treatment free of charge.
80% of the learning actually takes place through the eyes. And we know that between 5 and 10% of the children have visual impairment. They don't know that they have eye problems, or they don't know where to get the treatment for the eye problems. Therefore, with this program that we have, using the teachers will be able to screen and identify those who have problems and refer them appropriately to eye care workers to be able to screen.
As doctors, I know we are very scarce, we are very few, especially the eye doctors who can be able to address all the problems of students' problems in the eyes. And so the technology that we are witnessing today has come in time. Simple technology that can be used by teachers to identify the pupils who have problems. And from there, they are able to refer them for treatment and refer them in time.
Eye problems affect 13.5 million children in the land. And therefore, when you come up with this program, we are happy to associate with you, because we know that the problems that affect our learners, that make them not perform well in achieving the education system, in achieving the education as we expect them to do, is going to be solved with early screening. As the children grow up, the problems become more and more, because without early identification, the eyes of our learners will get worse and worse.
As county government of Uasin Gishu, we are also in the process of putting up a complete, I would say, integrated assessment center and also a special school. Our vision for that assessment center in Chebolol is to have an assessment center that will assess all the people living with various disabilities in this county and even other counties, so that they can be given the correct assistive device or treatment after being assessed. And secondly, establish right from ECDE to primary and secondary a special school in that center, complete with a level 3 facility to make sure that anybody who has some form of disability is well taken care of, and where the interventions can be given at an earlier age, that would be the best thing that we would want to happen. Because we know very well, when you give corrective measures at a younger age, the chances of that child succeeding or being able to do what they would not have done for the rest of their life is extremely very high. And we also want to encourage parents, those who have children with various disabilities, not to leave those children at home or carry this perception and belief that they cannot do better, that they cannot stand for themselves. I want to tell you here today that if we help these children do the correct assessment, give them the correct intervention, I can tell you they can stand for themselves, they can work for themselves, they can be effective public servants and private servants, and they can even do better than some of us with all the disabilities.
If you don't have eyesight, you really have issues. And I'm really grateful to our partner, Operation Eyesight, because of targeting the young age.
This project we have started in 3 sub-counties, namely Soy, Ainapkoi, and Tarbo, and hopefully will extend to others. So far, we've already trained 20 teachers, we call them EACs, who have screened more than 40,000 learners and referred over 2,002 for treatment. Out of these, 5 have undergone major surgeries, and 95 have received free glasses.
They worked hand in hand with the county government of Uasin Gishu to put up the eye center at Huruma, and more importantly, Your Excellency, they have supported us in equipping the hospital, and also through the 3 or 4 years now, they have screened well over 100,000 patients.
70% of the budget that constructed the Huruma Eye Unit actually from the governor's office.
It's now my pleasure to declare Operation Eyesight Unit, in collaboration with Ministry of Education, County Government of Uasin Gishu, eye health screening in our schools in the 3 sub-counties officially open and launched, and looking forward to launching in the 3 other sub-counties.